You're watching Stroke Smart on ABC 27, presented by the Penn State Hershey Clinical Neuroscience Institute.
And welcome back. Now joining us is Dr. Robert Harbaugh. And Dr. Harbaugh is a professor and chair of Penn State Hershey Neurosurgery and director of Penn State Hershey Clinical Neuroscience Institute. And we've talked, Doctor, about several ways to help minimize the chance of a person having a stroke, but there are many types of strokes. Are there any elective surgeries for something like this?
Yeah, well, Dr. Cockcroft has already talked about some of the surgical and endovascular treatments that are available for abnormal blood vessels inside the head. Another common cause of stroke is narrowing of the blood vessels in the neck that carry the blood to the brain. For instance, in patients with severely narrowed carotid arteries in the neck, an operation called an endarterectomy, cleaning out the cholesterol that's built up over years, can substantially reduce your risk of stroke, but only if that operation can be done with a very low complication rate.
Okay, well, Doctor, I'm going to have to jump to another question because we want to talk about this, the Comprehensive Stroke Center. Right. Now, what does that mean and how does that benefit the patient?
Well, a Comprehensive Stroke Center offers the complete spectrum of patient care, education, research, community outreach. And I think it's very important for the patients of central Pennsylvania to know that if you live here, you don't have to go to Pittsburgh or Philadelphia or Baltimore, that the Penn State Comprehensive Stroke Center really offers internationally recognized specialists in neurosurgery, neurology, radiology, and rehab, and that people in central Pennsylvania don't have to travel to get the best stroke care.
That's important that the family's all in one place, and that takes one more worry away from them. Well, patients can often face a variety of side effects from a stroke. The important part is receiving intensive therapy to maximize their opportunity for a full recovery.
Nice job. Nice job.
They look like simple steps, but little is simple after a stroke. John Tobin had a stroke about a month ago. He says he ignored his risk factors: high blood pressure, high cholesterol, and diabetes.
I was very bullheaded, and I didn't take my medicine. I smoked very heavy every day. I smoked a pack a day of cigarettes, and I just didn't take things serious. And I figured, oh, well, you know, I'll just keep on continuing to work, and I'm invincible, and no one's invincible no matter how old they are or what age they are. I found out that strokes can happen at any time.
After his stroke, he had weakness in his left side, balance problems, and vision loss in his left eye. To get special help with his recovery, he found Penn State Hershey Rehabilitation Hospital. It's an inpatient facility and a partnership between Penn State Hershey Medical Center and Select Medical Corporation.
Doctors and therapists here work closely with patients who've suffered stroke, brain injury, and spinal cord injury. The treatment they offer includes speech, occupational therapy, recreational therapy, and physical therapy.
We have therapy in a special therapy gym where we have state-of-the-art equipment, as well as having the therapists work with the nurses and a team to make sure that the patient gets what they need to be successful when they leave. So it is a full team effort. I think embodies what good rehabilitation can do for patients.
For John, small steps have quickly added up to larger gains, and he and his wife don't take that for granted.
Everything has been rehabbed so far back to somewhat normal. I'm still having left problems with the left eye, seeing out it, and I'm going through therapy with that.
Since this happened, he's on top of it. You know, and I told him, I said, you know, you're very lucky because this stroke could have been very severe. He had a mild stroke. If he would have had a worse stroke, then God knows what would have happened then. You know, it could have been much worse.
Well, his story clearly shows that taking care of yourself is very, very important, and we'll be right back.